Hi, I'm Dr. Shivadev, Psychiatrist and Sexual Health Specialist. I have about 16 years of experience in dealing with psychosexual health and mental health too. My clinic is in Koramangala. I'm a co-founder of PassionFruit Top-Notch Wellness. Delay condoms are most commonly used by a lot of people thinking that it will help them to improve their performance. This works because there's a local anesthetic like lidocaine or benzocaine, which is as a part of the condom given to you, which reduces the sensitivity of the glans or sometimes overall penis, thereby reducing the signals that goes to the brain, helping you to prolong your sexual activity. However, it also comes with its own merits as well as demerits. While this improves your performance sometimes, some feel it's way too much, because of which they don't have any sensations at all. They find it very dissatisfying when it comes to the performance or the way they feel after using these condoms. The most important misnomer or commonest problem that we see is using long-lasting tablets. While a lot of people believe that it helps them to improve their performance by lasting longer, these are actually some medications, if you know, it's mostly a PDE5 inhibitor which is sold as a long-lasting tablet. That is the main problem, because PDE5 inhibitors do not really help in prolonging your ejaculation time. Instead, it can cause a lot of risk factors like increased heart rate, flushing, headache, severe muscle pains or body aches, and sometimes causing a lot of cardiac conditions too. So it is important to know when to take and what you're taking. The performance pills or so-called performance pills, which are part of the over-the-counter medications, are not always a go-to choice because you don't know what you're taking and if these medications actually help you in your conditions or not. I commonly get this question like, can I take over-the-counter medications because it helped me last time, or my friend has taken this tadalafil and sildenafil and it helped them to prolong their ejaculation time and also help them in their bedroom. But without medical supervision, using any of these medications, I strictly do not recommend at all, because you don't know how these medications may affect you internally, or you may not understand what other medical conditions you may be having and how it can interact with each other. And some other medication that you may be taking for some other medical problem can have serious complications and interactions, thereby leading to a lot of cardiac conditions too. And especially in older men, when they have a pre-morbid condition such as hypertension, diabetes, and already on anti-hypertensive pills and nitrates, this can lead to serious deadly combinations. This can lead to a lot of serious complications and fatalities as well. So I cannot recommend taking over-the-counter medications of tadalafils and sildenafils to anyone because of these underlying factors. The reason why people are trying to take these OTCs is about improving the performance. But take a step back and think, is it really only about performance, or do you feel mutual satisfaction is more important? So make it more about pleasure and satisfaction and less about performance or counting your stopwatch to see how long you lasted. Isn't it only about mutual satisfaction in the end that thrives and helps you to feel better about your sexual experience?